Hello guys, Vanakkam and welcome to Media Nursing Academy, one of the leading academy in training nurses in the nursing competitive exam as well as IELTS and OET training. And in today's session, we are going to discuss about JIPMER Nursing Officer exam question answer solution. So recently JIPMER exam got over and we are going to discuss the questions with rational in detail. So listen to the video till the end. If you like this video, please like it, share it, subscribe it, and don't forget to click on the bell icon. Let's begin the session. The first question is, ABG analysis shows that pH is 7.34, partial pressure of carbon dioxide is 48 mm of Hg, bicarb that is 24. And they have given four options, that is respiratory acidosis, respiratory alkalosis, metabolic acidosis and metabolic alkalosis. It is a simple and direct question. In order to solve this question, you should know the normal arterial blood gas values. What are all they? pH 7.35 to 7.45, bicarb 35 to 45 mm of mercury, and partial pressure of carbon dioxide 35 to 45 mm of mercury, and bicarb is 22 to 26. You should know these three values in order to solve this question. Okay, let's see. See what is happening here. Here the pH is less. pH is less. If the pH is less, it is considered as what? Acidosis. Acidosis. So what we supposed to do? We can remove the alkalosis option from here. So respiratory alkalosis I have removed, metabolic alkalosis I have removed. Remaining is respiratory acidosis and metabolic acidosis. Fine. Now we can go to the next one, that is partial pressure of carbon dioxide. The normal partial pressure of carbon dioxide is 35 to 45 mm of mercury. And here the partial pressure of carbon dioxide is 44 mm of mercury, that is it is increased. Okay, and let's see the next value, that is bicarb 24. Here the what is the normal bicarb? 22 to 26, whereas here it is 24. So it means it is coming in the normal range. This is in the normal one. So don't worry about the bicarb, don't think about the bicarb. You have to focus now on the partial pressure of carbon dioxide only. So partial pressure of carbon dioxide is increased. So pH is acidic, that is pH is decreased. Okay, and partial pressure of carbon dioxide is increased and bicarb is normal. So in this condition it is called as what? Respiratory acidosis. Fine guys, that's why we selected option A. Respiratory acidosis is the right answer. Let's move on to the next one. Depression. Triple triad is. In depression, what is called as triple triad? Helplessness, worthlessness, thoughtfulness. Helplessness, hopelessness, worthlessness. Hopelessness, mindfulness and thoughtlessness. Understand the options very clearly. In case of depression, what characteristics features the patient will be having? Definitely helplessness will be there, worthlessness will be there. Thoughtfulness is a positive thing, it will not be there in the depression, so remove the first option. Second one, helplessness will be there, hopelessness will be there, worthlessness will be there, so there is a chance for this one. Third option, hopelessness, mindfulness, thoughtlessness. Mindfulness will not be there, it is a positive sign. Okay, it will not be there in the depression. So which is the right answer here? Option B, that is helplessness, hopelessness and worthlessness. Okay, B is the right one. Next, question number 3. On the patient with psychiatric condition received carbamazepine drug, and the nurse found on the investigation the carbamazepine serum level is 8 mg per deciliter. What would be the nurse will do next? So here they are asking, the person is taking carbamazepine. Carbamazepine is a mood stabilizer. Okay, usually it will be given for many clients. Fine. Okay, so the nurse found on the investigation carbamazepine serum level is 8 mg per deciliter. What would the nurse will do next? They have given four options, that is stop the drug immediately, document the finding and give the next dose of drug, inform the physician immediately. and fourth option we doesn't receive. Fine. So which is the right answer here? For answering this question, you should know the normal value of or normal serum level of carbamazepine. The normal serum level of carbamazepine is 5 to 15 mg per deciliter. So 8 is coming under 5 to 15, right? So this is the right level of serum in the blood. So what we supposed to do? We have to take the option B. Document the finding, because it is coming under the normal value. So you have to document the finding and give the next dose of drug. Fine. Okay. So here the answer is option B. And the next one is, in an emergency, the client admitted after an accident with the head injury. There is an head injury, okay? In the neurological examination, he shows that eye opening or painful. Eye opening is painful, okay? Second, repeated use of sentences, that is inappropriate words. Withdrawing the limbs for pain, okay? That is, okay, let's see. What is the GCS score of him? So three things they have given very clearly. Open with the painful stimuli, repeated use of sentences, withdrawing the limb for pain. If these three things is there, means what is the value in Glasgow Coma scale? See, you can see here, open with painful stimuli. To pain is opening, right? So here 2. Repeated use of sentences. So repeatedly they are using the sentences, means the sentence option is not there. Instead of that, inappropriate words are there. So repeatedly they are using inappropriate words. So here you can go for 3. And the next one is withdrawing the limbs for pain. So moves to localized pain. Okay. So here the score is 5. So 5 plus 3 plus 2, it is 10. So we have to go for option C, that is 10. And the next one is newly introduced contraceptive method, that is CHHAYA, Chaya is. It is a progesterone pill, combination of estrogen and progesterone pill, non-steroidal and non-hormonal contraceptive pill, injectable progesterone. See, Chaya, it is a non-steroidal and non-hormonal contraceptive pill. It is newly introduced pill in USA, and weekly once they have to take the pill in order to maintain the contraception. So option C is the right one. The next one, oral contraceptive pill produces which of the side effect? Oral contraceptive pill produces which of the side effect? It is a direct question and 4 options given here, that is depression, insomnia, vomiting, and here the right answer is option A, that is depression. The next one is, what is double Dutch method of contraception? Simultaneous use of condom and oral contraceptive, using female condom, using vaginal Dutch. And this is also a direct question, and here the right answer is double touch method, means double means 2, right? So simultaneous use of condom and oral contraceptive, here they are using the 2 methods, whereas here using female condom, it is a single contraceptive method. Using vaginal Dutch, it is also a single contraceptive method. So these 2 options we have to eliminate, and remaining one is option A, that is simultaneous use of condom and oral contraceptive. This is the right answer. Next one, find the next number in the series. So they are asking the next number. So they have given 6, 11, 21, 36, 56, and they are asking the next number. Here we have to check the connectivity of each and every number. For example, you have to do what? Just do like this: 6 minus 11, 11 minus 21, 36 minus 21 minus 36, 36 minus 56. So 56 minus what will give the answer? Okay, let's see. 6 minus 11, it gives 5. 11 minus 21, it gives 10. 21 minus 36, 15. 36 minus 56 is 20. So 56 minus something, it will give what? 25, because it is the connectivity is increasing in 5 numbers. Okay, 5, 10, 15, 20, 25. It is increasing like this, right? So 56 minus which will cause 25. 56 minus 81 will give 21. Sorry, 25. So which is the right answer here? 81. Understand? So you have to check the connectivity in order to solve this question. Fine. Okay, let's see the next one. A 15-year-old child admitted in the pediatric unit with rheumatoid fever. Which intervention will elevate the person from this problem? Keep both legs in the extended position. Keep the leg in flexion position. Use bed cradle to prevent lean weight over the joint. Use the rolled sheet under the leg to provide comfort. See, rheumatoid fever, all the joints of the patient will be having severe pain. So in order to elevate the pain, what we supposed to do is we can use the bed cradle to prevent the leaning weight over the joint. Obviously, keeping both legs in extended position or keeping the legs in the flexion position. Use the rolled sheet under the legs to provide comfort will not elevate the problem of the patient, whereas using a bed cradle to prevent the weight over the joint will prevent the pain of the patient. So here the right answer is option C. And the next one is, according to WHO, the active stage of labor can need to be started at. They have given 4 options. From the second stage of labor, cervical dilatation is 2 cm, cervical dilatation is 4 cm or more than 4 cm, and option D is from active painful contraction. So in order to solve this question, you should know 2 types of labor. There are 2 types of labor. Otherwise 2 phases of labor, that is, latent phase and active phase. Let's discuss about the latent phase first. See, in latent phase, the cervical dilatation is going to be 0 to 3 centimeter. That is the first thing you're supposed to remember. And second one is pain. The pain is going to be same like menstrual cramping with low back pain. During menstrual cycle, the person will be having pain, right? The same type of pain will be there. And the third one is contraction. See, contraction, more than 5 minutes apart, the contraction will be there. Between each contraction, it will take more than 5 minutes. And last for 25 to 35 seconds only. And it is considered as a mild contraction. So in latent stage or latent phase or active phase, whatever it is, we have to consider 3 things. That is cervical dilatation, pain and contraction. In latent phase, cervical dilatation is only 0 to 3, pain like a menstrual cramping pain, and contraction is more than 5 minutes apart. The contraction is there and it is 35 seconds. It lasts for what? 25 to 35 seconds. Okay, these are all the golden points here. Whereas if you come to the active phase, so active phase is given in the question, right? So listen carefully. Here the cervical dilatation is 4 to 7 centimeter. This is the first golden point. And second one is contraction is more active, severe contraction is there. Fine. So what I am going to describe about the contraction now. The contraction is more frequent and it happens every 3 to 5 minutes. The contraction is happening what? Every 3 to 5 minutes. In latent stage, more than 5 minutes. Means the in between two contraction, the time period is more than 5 minutes. Whereas here, every 3 to 5 minutes, the contraction is happening. And the contraction is lasting for 60 seconds in active phase. Whereas in the latent phase, how many seconds it lasts? Only 25 to 35 seconds is lost. Whereas here, 60 seconds, the contraction is continuously maintaining. And the severity of the contraction is moderate to strong. Whereas in the latent phase, the severity is mild. Whereas here, the severity is very strong. Okay, so you have to consider these 3 points. In active phase, cervical dilatation is 4 to 7, right? So here, which is the exact answer, which is near to the active stage? The cervical dilatation is 4 centimeter or more than 4 centimeter. That's why we selected option C. Fine. The next one. The child with severe headache, fever, stiffness, physicians suspect for meningitis. What is the confirmatory assessment for this? It is a simple and direct question. In case of meningitis, the confirmatory test is option A, that is lumbar puncture. Ergometrine is contraindicated in preeclampsia, preterm labor, gestational diabetes, postterm labor. Ergometrine. What is the indication for ergometrine? What medicine is this? It is used in the active management of third stage of labor. Which stage of labor? Third stage of labor. Okay. During heavy postpartum hemorrhage. Very important golden point. During heavy postpartum hemorrhage, during third stage of labor, postpartum hemorrhage might be there, right? So in that situation, what we are using? We are using what? Ergometrine. Fine. So what is the contraindication for ergometrine? It is used for reducing the postpartum hemorrhage. So what it will do? It will cause severe vasoconstriction. Fine. So in case of severe vasoconstriction, what will happen? Increase in the blood pressure. And it will also cause what? Angina-like pain. Because of the contraction of the coronary artery, angina-like pain will be there. So this drug is contraindicated in patient who is suffering from hypertension as well as cardiac disease. Contraindicated in hypertension and cardiac disease. The side effect of this drug is nausea, vomiting, abdominal pain, chest pain, palpitation, severe hypertension, stroke and myocardial infarction. These are all the side effects. So which is exactly resembles the contraindication among these 4 options? Preeclampsia, preterm labor, gestational diabetes, postterm labor. The only option which is exactly coming under ergometrine contraindication is preeclampsia. So what is happening in preeclampsia? Blood pressure is going to get increased. Fine. So the right answer is option A. 13th question. The rotation of the trunk of the fetus during a breech birth to facilitate delivery of the extended fetal arms and shoulder. Which type of maneuver is this? See, first listen to the keywords which is there in the question. The keywords are breech presentation, extended fetal arms and shoulder. So in case of this problem, what maneuver we supposed to use? What is Wood's maneuver? In case of shoulder dystocia, we can use the Wood's maneuver. Only in shoulder dystocia. What is Lowset maneuver? If the baby is presented with breech presentation, with extended arms and shoulders. If these three golden points, breech presentation, extended arms and shoulder, this type of presentation is there, means you have to go for what? Lowset maneuver. And the last one is Mac-Roberts maneuver. It is also same. We can use this maneuver for shoulder dystocia. So we can remove option C. and option A, because these two options is only used for shoulder dystocia. The remaining one is Lowset maneuver. That's why we selected option B as a right one. Okay, the next question is patient with right leg tibia and fibula fracture. Where is the fracture? Tibia and patella fracture. Patella is the bone which is there in the knees, right? Knee joint, patella bone is there. So patella is fractured and leg tibia is also fractured. To make the client mobilize, what is expected nursing action done? So what type of exercise we can do in the affected area? And here the right answer is option D, that is quadriceps sitting exercise. So you can see in this image, the person is sitting and there is a rolled towel kept below just exactly below the knee joint, and she is doing dorsiflexion exercise, dorsiflexion of the foot. Okay, so this type of exercise, it is used in case of patient who is had leg tibia and patella fracture. And what are all the things contraindicated? Passive range of motion to the hip is contraindicated. Knee can be flexed. Already there is a fracture. If they are flexing the knee, what will happen? Again, the problem will increase, right? So flexion and extension of the legs, all these three things are totally contraindicated. And the remaining, which is their quadriceps sitting. They are sitting, keeping that rolled towel below the knee joint, and they are dorsiflexing the foot. Okay, so this is the type of exercise. Fine. And the next one is question number 15. After the cleft palate surgery with 2 days post-operative period, which one of the feeding is used? Here the key point you should note in the question is, after the cleft palate surgery, the baby undergone cleft palate surgery with second post-operative day, which method of feeding you supposed to use? Second post-operative day. Post-operative day means it is very painful day. That too after the cleft palate surgery. We cannot use the cup or spoon to feed the baby. Instead, what we supposed to do? We can give a small straw. The rubber tipped syringe we can use. Okay, so that it will be very easy for the baby to suck the content from the bowl. Okay, so the right answer here is option A, that is rubber tipped syringe. The next one, question number 16. The patient admitted in the emergency department with a direct stab wound on the left side of the chest and excess blood loss. Patient blood pressure shows 80/40 mm of mercury. Heart rate is 110 beats per minute. What may be the expected diagnosis? Cardiogenic shock, neurogenic shock, anaphylactic shock, and hypovolemic shock. The keywords of this question is, there is a direct stab wound injury. Stab wound means something is directly penetrated into the body part. On the left side of the chest, an excessive blood loss, very important point, very important keyword, that is excessive blood loss is taking place. Because of the blood loss, the BP is dropped. In order to compensate the BP, the heart is pumping more. That's why the heart rate is 110 beats per minute. So in this situation, what will be the diagnosis? So definitely, if there is any bleeding and blood pressure is dropping, in the order to compensate the blood pressure, if the heart rate is increasing, means directly you have to go for what? Hypovolemic shock. So this is the characteristic feature of hypovolemic shock. So option D is the right one. What about cardiogenic shock? See, heart cannot pump adequate blood to meet the body needs. Heart cannot pump the adequate blood to meet the body needs. That is called as what? Cardiogenic shock. Neurogenic shock is commonly seen in patients who underwent spinal cord injury. Fine. See, irregular blood circulation will be there. That is decreased blood pressure, decreased cardiac output, peripheral vasodilation. These are all the characteristics of neurogenic shock. Okay, and the last one is option C, that is anaphylactic shock, commonly seen during the allergic reaction. What are all the characteristics of anaphylactic shock? Sudden drop in the blood pressure, airway narrowing and breathing difficulty. It also mainly caused because of what? Severe allergic reaction. Okay, so in considering all these things, we selected option what? Option D. And the next one is question number 17. The child with seizure receiving phenytoin for the treatment. What would be the effective teaching for the mother to care the baby at home after discharge? So here the keyword is the baby is having seizure and receiving phenytoin. What kind of care as a mother you supposed to give? So you should know the side effects of phenytoin now. Okay, so what the phenytoin will do? It will cause gingival inflammation. The side effect of phenytoin is gingival inflammation, tooth decay and bad odor. So gingival inflammation, tooth decay and bad odor means halitosis will be there. So instead, by seeing all these things, by considering all these side effects, what we supposed to do in order to elevate from this problem? Whether we need to drink plenty of fluid, whether it is going to use for the patient? No. Monitoring WBC count? No. So which is the remaining one? Ask him to brush the teeth after each meal to prevent the inflammation, decay of the teeth and halitosis. After every meal, the baby or the child has to brush the teeth. So here the right answer is option A. Fine. And the next question is, female client with positive human papilloma virus shows which finding? Here the keyword is human papilloma virus, and which finding, which manifestations will be there? Painless ulceration of vulva, foul smelling vaginal discharge, an irregular wart on perineal area, and ulcerative wound on vulva. It's a direct question, and here the right answer is option C, that is irregular wart on perineal area. Okay. The following symptoms not commonly seen in HIV infected patient. Not commonly seen is the keyword for this question. Okay, fine. So 4 options they have given here: fever, swollen glands, sore throat, gingivitis. Fever will be present, swollen glands will be present, sore throat will be present. There is no chance for gingivitis. It is very rarely seen. Okay, so here the answer is option D. Next question is the expected complication in Kawasaki disease. Mitral stenosis, atrial aneurysm. Here the keyword is Kawasaki disease. What is Kawasaki disease? In Kawasaki disease, inflammation of the coronary arteries will take place. Which artery? Coronary artery. It is previously called as mucocutaneous lymph node syndrome. Very important, already they have asked question from here also. Mucocutaneous lymph node syndrome. Because it causes swelling in the lymph nodes and mucous membrane present in the inside the mouth, eyes, nose and throat. So which is the right answer here? The expected complication of Kawasaki disease is option B, that is atrial aneurysm. Atrial aneurysm. This is the right answer. Option B is the right one. Okay guys, rest of the question we will be discussing in the next videos. If you have any doubts anywhere in today's video among these 20 questions, you can comment us in the comment box. And please tell the leftover options. In some questions only 2 options are there, 3 options are there, other options are missing, right? So if you know the options, you can tell the options also. We will be correcting according to that. Fine guys, so thank you very much for watching this video. Please follow us in Meteor Nursing Academy YouTube channel.